rising cost of housing and goods is not only having an effect on our economy and culture, it's also crippling Hawaii's healthcare system. Medical professionals, especially in rural areas, are taking their practice elsewhere. A study by WalletHub examined the salary versus living costs, as well as other factors for doctors, and ranked Hawaii 51st. That's below all the states and the District of Columbia for physicians to practice medicine.
We've had the prepaid healthcare plan for 30-some years, which is wonderful, but we all get very good insurance, and it's not very expensive. So to keep the rates low, the pay to the physicians and the healthcare workers is fairly low. And actually, it's low compared to the entire rest of the country. Half of what you could make somewhere else.
To offset some of that financial burden, the University of Hawaii's John A. Burns School of Medicine worked on the creation of HELP, the Healthcare Education Loan Repayment Program, a mix of state, federal, and private donations. Already, 500 healthcare professionals have had some or all of their education loans cleared.
It's huge. It's huge. I can't even, I have no words for it. That's how big it is. Just, you know, it's like you win the jackpot.
Eludriza Tabisola Nuesca is a nurse practitioner at Kapiolani Medical Center. She had $100,000 in student loans. The HELP plan is now paying down $25,000 per year as long as she continues to work in Hawaii. Prior to getting approved with HELP in December, she talked about moving the family to Texas.
I've always told my husband it's time to move. We gotta go. It's too expensive here. $100,000, like you go in to pay and it's like not even budging. So I usually pay up above the minimum, but it's still not budging.
This is a list of healthcare professionals who could qualify for loan repayment through HELP. That's because all of these are needed to keep Hawaii's population healthy. Certain workers are eligible for even more money.
If they're in primary care or behavioral health, or they're a doctor, nurse practitioner, or physician assistant in a rural area, which is some of Oahu and all of the other islands, they get $100,000 over 2 years. So $50,000 a year. But it's not paid to them, it's paid to their bank. So there's no tax.
Hawaii workers say the state is hitting a critical point. Locals are willing to leave now more than ever to join a community elsewhere that can offer goods and services while allowing them to continue important cultural practices. All without the financial burdens. More needs to be done to help those willing to stay despite high costs and worker shortages, which have already had a devastating toll, forcing many small businesses to shutter. The phrase, "priced out of paradise," is a common way to explain the exodus, an all-encompassing term for why so many are saying aloha to the Aloha State.